Okay, so good evening. My name is Hannah, and I am a patient access coordinator with Northwest Medical Specialties. I am also a member of the cancer support community. I wanted to introduce cancer support community and who we are. Cancer support community is the largest professionally led nonprofit network in the world, providing free cancer support to everyone in the community who has been touched by cancer. Through our partnership at Northwest Medical Specialties, we can bring free programming like these educational workshops, healthy lifestyle classes, social activities, support groups, and other resources and support. We do this so that no one has to face cancer alone. I am going to go over a few housekeeping rules tonight. You may have noticed that upon entry that you are muted. We do ask that you remain muted for the entirety of the presentation. This way everybody can get the most out of tonight's presentation. If you feel like you have any questions at any time throughout the presentation, there is this amazing feature called chat at the bottom of your Zoom screen. You can enter your questions in there at any time and we will be happy to address those. And the last handy tip is in the upper right-hand corner of your screen, there is a view button. If you click that and then select speaker view, this will give you the best viewing option for tonight. That being said, I will hand this over to my colleague, Caitlin.
Hello, everybody. I'm Caitlin, and I'm the Program Director for Cancer Support Community, and I'm also a social worker at Northwest Medical Specialties. I am going to read the bio for our wonderful speaker tonight. So Carole Burger is a former labor relations negotiator and human resources manager for state and local governments and later for school districts. Since then, she has, for the last 9 years, volunteered for SHIBA, that is State Health Insurance and Benefits Advisor for Washington State through the Office of the Insurance Commissioner. So without further ado, welcome, Carole.
Thank you. And welcome, everybody. This is what I call Medicare 101. It's an overview, and we're going to talk about the basics of Medicare, enrollment, drug plans, Medigaps, which are also called Medicare supplement plans, Medicare Advantage plans, a different form of getting additional insurance, some assistance programs that depend on income and resources, and then a little bit, not a lot, about Medicare fraud. Retiree plans, I don't go into other retiree plans. I don't go into a great deal, although I do deal with all of these a bit. But as far as the details of such plans, I mean, details, you need to talk to the plan because they all have their own set of rules, and you need to know those as well as what's available under those plans. It's just good information whenever you deal with Medicare, Medicaid, Social Security, to keep a notebook and to write down the names of people you talked to, what was said, when you talked to them, what was agreed upon or not, and copies of any paperwork. It's very difficult when paperwork is lost either in Medicare claims or Social Security issues to reconstruct. Okay, what is Medicare? Medicare came along in January 1966, and it is for people that are 65 and older, or those that are disabled, people that are disabled under 65. That's disabled through the Social Security Department of Social Security Administration. End-stage renal disease or Lou Gehrig's disease, ALS, and a permanent citizen's permanent residence or a legal permanent resident of 5 years or more. The Centers for Medicare and Medicaid Services administer. There is a Region 10 Office of Medicare and Medicaid Services in Seattle. Enrollment is done by the Social Security Administration or the Railroad Retirement Board, which is just like Medicare. Okay. The 4 parts of Medicare are Part A, Part B, Part D, which is drugs, and Part C. Part A is hospital. Hospital care is semi-private rooms, meals, general nursing, and hospital services and supplies. It is not the medical part. Inpatient mental health care is also part of hospital, and that's limited to 190 days per person. Part B is what covers medical, including doctor services. And it covers any medically necessary service. That would include skilled nursing if medically necessary, home health if needed, that kind of thing. Part D are prescription drug plans, which covers prescription drugs, not over-the-counter drugs. And most of these plans are really good with generics, not so good with brands. These 3 are called, well, this is original Medicare, Part A, Part B, with a drug plan. And we'll talk about why in a minute. Or it's possible to go with the Medicare Advantage plan, which is a combination of these 3 things under a private sector company under agreement with Medicare. Okay, so hospital insurance, we talked about hospice care, skilled nursing, home health care, medical. Durable medical equipment are things like diabetic supplies, the lancets and those monitors and those things. Durable medical equipment are things like anything, chairs or walkers or those kinds of things. Preventative services are those checkup kinds of things, and many of those are free under Medicare. Medicare cost. Part A is free if you've worked 40 quarters. That's the Social Security 40 quarters. The spouse or the enrollee. If you don't have those quarters and you don't have a spouse that has those quarters, then it is possible to pay a premium to get Part A. It's quite expensive. It costs, for less than 30 work credits, it costs $259 a month. So it's fairly expensive. However, to get additional insurance under Medicare, you need both Part A and Part B. So sometimes it's worth it. Part B at the moment, medical, costs $148.50 a month. If your income is, I don't have the scale, I don't think, but if your income is over 89,000, I think it is, then that will bump it up. Your premium will to be over 200 a month. And on up as your income goes up. That comes every year to you through a notice from Social Security. Costs of Medicare Part A, hospital has a large out-of-pocket deductible. Every 60-day period is $1,484, and that's every 60-day period. So theoretically, if you went in the hospital now, not in an emergency room, admitted in the hospital, you'd have a out-of-pocket deductible under Part A of $1,484. then if you were released and you went home and 6 months later you went back in, you would have another $1,484 out-of-pocket deductible every 60 days. The yearly deductible for Medicare Part B is $203 in this year. Medicare Part B, excuse my dog, I can't, whoa. Medicare Part B pays only 80% of the medical. So 20% is always out of pocket unless you have some additional insurance. It's important as you approach Medicare age or disability, under disability rules, you have disability for 2 years and then you automatically are put on Medicare. So at that point, you still have some decisions to make. Step one is enrolling in Medicare. And there are a couple ways you can get your Medicare. One is original Medicare with a drug plan, with a Medigap, Medicare supplemental insurance. Medigaps are also sold by private sector companies, same private sector companies that sell Medicare Advantage plans. But what they do, they're called Medigaps because they fill in the gaps. There's a large hospital deductible, remember, and there's 20% copay in Part B Medicare. Those are called gaps, and Medicare fills those gaps. So if you had original Medicare and a Medicare supplement, any Medicare eligible expense would be paid 100%. The Part D prescription drug coverage, Medicare will tell you you don't have to buy, but if you don't buy it and you need drug coverage later, past your eligible period, they will penalize you, and they will penalize you from then on. So it's important to get drug coverage. Medicare doesn't cover everything. Medicare doesn't cover long-term care. It doesn't cover glasses. It doesn't cover dental. It doesn't cover hearing. Dental care, not dental, cataracts are medical procedures that are covered under Medicare. The enrollment period for Medicare. If you are already in the Social Security system, you'll get Medicare automatically. They will sign you up. You're automatically enrolled at age 65, or again, if on disability, you will be enrolled after 2 years. If you don't have Social Security already or aren't in the Social Security system, you must enroll in Medicare. Right now, that's a little difficult to do because many of the Social Security offices are closed. Although I do understand that the one in Tacoma, and I think the one in Puyallup was open. But those, you can call those offices if you need to go in there. You can enroll online with the Social Security Administration. You can enroll in Part A, Part B, or both for Medicare. You can always call. This is, if you're going into the office, go ahead and call this number and make an appointment at least. So you may have to wait, but at least you'll have an appointment. The Railroad Retirement Board operates the same way as Social Security in terms of signing you up for Medicare. There are 3 enrollment periods for people. The most important enrollment period is your initial enrollment period at 65. Now, even people who are disabled already on Medicare have an initial enrollment period at 65, which means they can redo, which is important in their cases, because in their cases, they don't have all the choices that everybody else has at until they reach 65. So the initial enrollment period is 65. If you miss that for some reason, and people do, there's a general enrollment period. The general enrollment period begins in January of each year. We'll talk about that in a minute. And then there's a special enrollment period for for things that happen, like if you move from one state to another, or one county to another in some cases, or you lose your insurance, or any number of things can set up a special enrollment period. The initial enrollment period for Medicare is 3 months before your birthday month, and 3 months after. So 3 months before you're 65, the month you're 65, and 3 months after. The later you enter, it's good to start early, because if you start early, your Medicare will start on the first day of your birthday month, no matter what date your birthday's on. The later you start, the later it is. And you may, if you give it less than, actually, if you probably give it less than about 90 days, no, say 75, 80 days, you're probably going to miss that first of the month. Anyway, that's a 7-month period that you have. During that period, you have certain options that you don't have otherwise. And so we'll talk about that in a minute. General enrollment is January 1st through March 31st. And you won't get Medicare, then you will have to wait until July 1st. So there's a penalty just of having to wait 6 months. Plus, it's possible that if you missed enrolling in your initial enrollment period, they can apply a monetary penalty. Special enrollment periods, probably the most important one, are for those who are working or whose spouse are working and who are covered by either their own employer insurance or their spouse's employer insurance. In those cases, people who are covered by active insurance don't have to sign up for Medicare, but probably should. If Part A is free anyway, so you might as well go ahead and do it. But the Part B is not necessary, because the employer insurance is going to pay first. Medicare would pay second. So you can waive the Part B and thus save some money until your spouse or you are not actively working. There's an 8-month special enrollment period when starts that after active employment ends. Now, these numbers get important. That special enrollment period after you stop working, I don't mean COBRA, I mean stop working. So your first day of non-work is beginning of that 8-month period, during which you can enroll in a drug plan and a Medicare Advantage plan. A Medigap plan, however, only has 6 months from the date you stop working. So let me put it this way, 6 months from the day you enroll in Part B, 6 months. So if you didn't enroll in Part B until you stopped working, you'd have 6 months. If you enrolled in Part B when you were 65, you have 6 months. That 6 months is important because it gives you some guarantees that let you buy a Medigap plan without any sort of health screen. So you may not need Part A if you're actively working or your spouse is. You always want to check with your employer insurance to see what they require. Some actually require that you go ahead and enroll in Medicare. When you quit actively working, sign up for B then. You have to have A and B to get a Medigap policy or a Medicare Advantage plan. You only have to have A or B to get a drug plan. You must now have to have A and B for TRICARE for life, military. So the Medicare card was, I don't know if everybody does this anymore. It's the way to tell them that you wanted to defer B was to return the card and tell them that you turn it over on the back and say that you were waiving B. Your Medicare card is your doctor's card. It's what you show for coverage. And that's what it looks like. Replacement cards are easy to get. Social Security, you can go to Social Security, have my Social Security account, and you get a replacement card. Medicare card scams. I just had a call. Last week. Interesting, because they wanted me. They wanted me. Let's see. I was trying to figure out what it was they were after. I knew it was a scam, and they wanted me they want to know if I use my own Medicare number, which of course used to be Social Security number, and I said yes, though that's not correct. And so they wanted me to get the card and read them the number so that they could change the card. But it happens all the time. They're never going to call you. No legitimate company, Medicare, Social Security is going to call you and ask you for information over the phone like that. Part D, Medicare prescription drug plans. Now, I'm not tracking. I'm assuming, are there any chats? No? Okay. Do feel free to ask a question if you need to. If you're, as I said, you could be subject to a penalty if you don't sign up within that initial 7-month Medicare eligibility period. I've had people that wait. Right now, the penalty is about $5 a year. But if you wait 10 years, or you wait 5 years, or it adds to whatever drug plan you then get, and it never goes away. And it adds each year, so it goes up each year. The Part D coverage is standalone coverage, we call it, goes with Medigaps, Medicare supplement plans, because Medicare Advantage plans include drug coverage, unless you have drug coverage like through the VA or something like that. Part A or Part B, you must call and enroll or go online and enroll in a Part D plan. Drug plans and Medicare are only within the country, in the US. Drug plans, employer plans, most all of them include drug plans, and they are obligated by law to let you know whether it's called credible coverage. And credible coverage is it's good or better than what Medicare Part D would have provided. Most all, but not all, most all employer plans are credible coverage. So Part D, the initial enrollment is when you should get a Part D. You can change those every year during an open enrollment period that happens October 15th through December 7th, coming up pretty soon. Your coverage starts the next year. So if you have a drug plan that you're not fond of, you can change it. Special enrollments, you can get a new drug plan if you lose your coverage, like when you quit, move to a new area. If you end up being eligible for assistance called extra help through Social Security Administration or a low income subsidy, which is the same thing, you are eligible to enroll at any time in a drug plan. To do that, SHIBA can help you. What we do is screen the list of prescription drugs through the plans to find that fits you best for the most complete coverage for the least cost. You can do that on Medicare.gov. You can screen it yourself and enroll in plans there. Calling the plans is always a good idea to check things like coverage of drugs that might be of concern to you, brand name, specialty drugs. Okay, Medigaps. So this is the way that if you keep original Medicare, you get a drug plan, then you have the option to buy a Medigap. As I said, Medigaps fill in the gaps in Medicare coverage so that medically you should not have to pay for hospital or medical expenses that are eligible for Medicare if you have a supplement. They were sold by private companies. They came into being right after Medicare itself did, sometime in the late 60s. Medigap plans are standardized. That means, well, let me go down here to, here are the plans. They are, let's see. These plans are, well, there are now 1, 2, 3, 4, 5, 6, 8 plans. There used to be C and F. They took those off the market in 2020. So unless you were 65 before then, you aren't eligible to buy those plans. These plans are, these are the benefits. So the Part A co-insurance up to 365 days of pay. Part B co-insurance, that's a 20%. Part A co-insurance is the 1460 something. Part A deductible, skilled nursing, hospice care. Part B deductible, excess charges. Excess charges are if a doctor that you have will accept Medicare patients, but doesn't have an agreement to accept Medicare prices, they can charge about 15% over what Medicare will pay. And so that's excess. Most plans, the comprehensive plans have foreign travel, which is limited. It's 80% of maybe 50,000, something like that. So the most comprehensive is Plan G, which pays everything except the Part B deductible. Plan F used to pay the Part B deductible, but it made no sense because every Plan F would charge just for the Part B deductible, which at the time was about 180 more than 180 a year. So you'd pay $15, $20 extra on the premium just to cover that deductible. Didn't make any sense. As you can see, some of these plans will pay $50, $75, and they're much less expensive. Plan N is a good plan. Now, Plan N has a 20% deductible, not 20%, excuse me, $20 deductible for doctors and a $50 deductible for emergency rooms, but that's all. And for that, the Plan N usually sells, it covers all the essential otherwise, and it usually sells for about $40 less than Plan G's. Okay. Medigaps don't have to sell to you if they will do a health screen and they may impose pre-existing conditions. So there is a period, the 6 month after you pick up Part B, the 6 months, the plan cannot deny you, cannot do a health screen, and thus you have what's called a guarantee issued to buy a Medigap, which is very important for people with serious diseases. After that, the plan can turn you down, or the plan could underwrite and charge you more than they charge anybody else. So this is something you need to keep in mind, because that 6 month window is gone. Once you've passed that period, you don't get that again. There are some special enrollment periods that give you 60 days, such as when you quit work. So we talked about if you quit work, then you have from the time you pick up, if you waived B, for example, then you have 8 months. Well, you don't have 8 months. You only have 60 days when you quit work to pick up a Medigap with the guarantee issue. Okay. Okay. Once you have a Medigap, you have a Medigap. Again, I said those plans are standardized, and I didn't explain that. Standardized means that within a plan, such as G, the coverage is the same, identical by law. So a G is a G is a G, whether it's sold by ARP or Primera or Humana or whoever. It's all the same coverage. Under a plan, the coverage is standardized. Okay. Once you have a Medigap, you have a Medigap, unless you give it up or you can't pay for it. You can change Medigaps as you want. You can change Medigap companies. You can change Medigap plans. You may apply or buy switch plans anytime. Okay, so that's a Medigap. That's the most complete coverage, medical coverage that you can get under Medicare, original Medicare, and a Medigap. And Plan Gs generally right now are running, well, they vary. Every company charges differently, but you can buy a Plan G, the most comprehensive right now, for about 171 to over 200. So they vary that much. Okay, that's monthly premium, but that's all you pay. You don't pay copays, you don't pay deductibles. Medicare Advantage plans. And by the way, there are handouts that the Medigap list is one of them, so are Medicare Advantage plans, so are drug plans. And so is this whole program here. If you want a copy of it, you just need to let them know and they'll send it to you. Medicare Advantage plans. Medicare Advantage plans are managed care plans, managed care like HMO, health maintenance organizations. Best example of that is like Kaiser, which is a totally self-contained health maintenance organization. It has its own doctors, it has its own specialties, it has its own hospitals, its own pharmacies, and so forth. So they're self-contained, and you must stay within the network to be covered. And so you have a primary care doctor who refers you, if need be, to other doctors. If you go outside the network, there are plans called PPOs, provider options, which charge you more but let you go outside the network. You can't do both. You can't have a Medicare Advantage and you can't have a supplement at the same time. It has to be one or the other. Medicare Advantages do carry drug plans, so you can't have a drug plan and a Medicare Advantage plan with a drug plan. Again, these are private companies. Part B premiums are paid whether you have a Medicare or a Medigap. The Part B premium you're still going to pay. You must use network doctors, and Medicare Advantage plans are sold by the county within the state. So they're very limited in what where they can travel, because if you have to stay in the network, you can't go out of the network or it's not covered. So now here in Pierce and King, because many of the companies sell the same plan in both counties, you can often go between King and Pierce, but that's about it in the state of Washington. They have all the rights and protections. They include A and B. They include a drug plan. One of the things that Medicare Advantage plans are allowed to do is offer additional benefits, such as dental and hearing and vision now. And lately they've been able to offer some transportation and some other additional benefits. But be aware that those are all very basic. They are not comprehensive. Dental is usually a couple cleanings a year. Hearing may be a test, and hearing aids are generally never covered. vision, maybe a pair of glasses every couple of years, and an eye exam. So that's the basic stuff. You can often, with dental particularly, you can often buy more through the company that you have your Medicare Advantage plan with. The initial enrollment period is your best time, of course, to buy any plan, but if you miss that, you have an open enrollment period for Medicare Advantage plans, the same October 7th, 15th through December 7th. Again, coverage starts the next year. Open enrollment, okay, the Medicare Advantage open enrollment period is a, that's not the right term. It's your it's your time to see whether you like a Medicare Advantage plan. If you don't, you can drop a Medicare Advantage plan that you enrolled in between January 1st and March 31st in the first year that you buy a plan. So the first year that you buy a Medicare Advantage plan, if you want to drop it between January and March, you can go back to original Medicare and then you could buy a Medigap. And you get a chance to change Part D plans. Special enrollment periods, we talked about this. It's those are moving, employer coverage, eligible for assistance, your plan did and now doesn't cover what you need, like drug plans sometimes. And no, so the sorry, so the excuse me. Sorry about that. There are others. Oh, like your plan quits and leaves the area. That happens every once in a while. Okay, again, Medicare Advantage plans are those things that we can help you screen for. We can, if you again, we use the drug list because Medicare Advantage plans have a drug plan. You can call us. By the way, the local SHIBA number is 253-212-3519. Now, that's Pierce County. So if you call the local number, you'll get a recording that says, tell them what you need. And some of us will call you back. I call back people on Mondays and Wednesdays, and we have people that pick up those requests and call back. And we can help you screen the Medicare Advantage plan the same way we do the drug plan. Or you can go to the Medicare.gov and enroll directly yourself. Sometimes people have, low-income people really just can't afford. And the assistance programs that are available are through the federal and state government, and they're mostly a combination of some federal and state cooperation through Medicaid monies. So if you needed help and you're very low income because the income levels are not high, there is a brochure that that they have here that you can also get, but we'll go through this. Oh, this is just paying for Medicare. So when you sign up for Medicare through Social Security, they'll ask you how you want to do it. And you can have your monthly deductions from your paycheck. You can be billed, you can pay. There's lots of different ways. Same thing with the drug plan. You can have that deducted from your Social Security check if you want to, or you can pay the Medicare Advantage plan directly. Okay. Medicaid programs, or not full Medicaid, but pieces of Medicaid program, provide these assistance programs for low income. One of them is called the Medicare Savings Program. It's a very important program because people that are now on the Affordable Care Act through the benefits exchange, what Washington did was expand, like many states, expand the limits so that people with 150% of poverty level income will qualify for supplemental help under the Affordable Care, under the benefit exchange in Washington. The problem is that you don't keep that when you move from the Affordable Care Act to Medicare. That 135, that 150% goes away, 135%, excuse me, and it reverts to its original income limit. So at the 100% poverty level, these are the income limits. That's monthly, and that's a couple, and then there's a resource limit as well, and these are the individual and couple resource limits. That's at 100% poverty level. That's not very much. At the 135%, this is the individual income and the couple, and the resource limits are the same. At this level, what gets paid is the Part B premium, which is $148.50 a month. So it's worth it. These are, you apply for the Medicare Savings Program through Department of Social and Health Services through their Community Connections offices, or you can call them, but it's better to go, if you can, go online. You can apply online. Prescription drugs, there is a program that the Social Security Administration runs called Extra Help, or Low Income Subsidy. Social Security is who makes the determination. Now, if you apply in this state for the Medicare Savings Program, you will have the opportunity to also apply for Extra Help. Or you can apply directly to Social Security for Extra Help by itself. That is not the same income and resource. It has a higher level. So here, Extra Help pays for drugs. Full Extra Help, this is the income level. It's the 135% of poverty level. And it pays premiums, deductibles, and your co-pays on drugs. The resource limits are also higher. Then there's a lower level at 150% of poverty level. These are the income limits and the resource limits. So people that maybe still can't qualify for the Medicare Savings Program can still get help with their drug payments. Medicaid is a federal program run through the states. It's a cooperative arrangement between the federal program and the state. And the federal regulations apply, and the state can change and modify to some extent. Full Medicaid covers everything. Full Medicaid covers all of your medical as well as dental and those kinds of, plus drug program. DSHS, the same application that you would use to apply for the Medicare Savings Program can be used. So it's a one application sort of process. So if you know someone that needs help, it's a good idea to have them apply for everything that they think they might qualify for, and DSHS will make the determination. Medicaid income is very low. That's $814 at 100% poverty level. I mentioned the Affordable Care Act. Medicare and the Affordable Care Act it can be supplemented by Medicaid if you're low income. But the Affordable Care Act was never intended for Medicare people. It technically is illegal to try and be under the Affordable Care Act and Medicare. Now, because of COVID, they have put some temporary rules in place so that people can stay on the Affordable Care Act and go into Medicare. That won't last forever, but that's the way some of it is working right now. It's very confusing. So it's not supposed to be, but right now there are people that have both. If you're under the Affordable Care Act and you and go into Medicare Part A, you can keep your Affordable Care Act, but any supplements you had will stop. And if you get Part A free, and then you drop it, it's, believe me, not worth it. You'd have to pay all your retiree benefits back. Again, I think probably those rules are suspended or modified right now, but I wouldn't test them. Again, if you're enrolled in a qualified health plan under the Affordable Care Act, you can keep Part A, but you lose any tax credits. How it's supposed to work is Apple Health quits when Medicare starts. This is just a caution. Remember, there's a period when you go past your initial eligibility period for Medicare, and then you're in a general enrollment period, which means you're going to lose coverage for 6 months or so. Okay. Medicare fraud is huge. Right now we have, what, 46 million people or more in Medicare. And the cost of fraud is in the billions. SHIBA, these are state health plan people. SHIBA is a term that they came up in Washington State, but mostly they're called, like people like me are called SHIP counselors. Anyway, within that there is a senior patrol, which is a fraud unit, and one of the best places to report fraud is SHIBA, or the Office of the Insurance Commissioner. Just, you know, we won't do the quiz, but here's interesting, huh? So $60 billion. And that's comes from 2 or 3 years ago. So here are some numbers. Here's the local number. When you call this number, it's at the Office of the Insurance Commissioner, and people will direct your call. Like I get notices from the Office of the Insurance Company to Commissioner to call people, but this is more direct, and generally we get more information if you call on this line. This is Medicare, Social Security.
About the local numbers. So we have a lot of people from outside of Pierce County. So can they still call this, or do they need to find their specific county?
Well, every county has a SHIBA. They can call us, and if it's something that we think, like, as I mentioned, the Medicare Advantage plans are not consistent county to county. So if people were looking for a Medicare Advantage plan, I'd have them call the person that represents that county, SHIBA, and I have those numbers, so they can call.
Okay, cool, thanks.
So this is the online application for assistance, Washington Connection offices. Okay. And the Office of the Insurance Commissioner is the office that has the SHIBA program. Complaints about insurance also go through them. And I should say, we take many complaints and then forward them to the Office of the Insurance Commissioner. So SHIBA number is a good number to have handy. And with that, I think I am done. Let me see. Where are we?
Yes, thank you, Carol. I don't see any questions in the chat. So I'm going to go ahead and stop the recording right now. Thank you, everybody who will be watching online. A big applause to Carol.
Well, if there are any questions, I'd be happy to answer them. It's not a difficult thing. I talk to you guys all the time about questions, so you can always, Abra particularly knows how to email me, so.
Right. Okay, I'm going to stop.